I've lived in this house 48 years. So I'm not moving. I don't care what anyone says. I don't want to leave my home unless I'm taken out in a box. I did all the garden. There was nothing here. We planted the hedge all round and planted trees and shrubs. And I just love it. Only thing is I can't garden anymore because of my legs. And they went when my husband died, and I was told it was because of shock. I've never been able to walk since. So
one of the challenges for us in West Sussex is we do have a relatively elderly population and really keen to keep their independence, and they do their damnedest to achieve that. And the idea of unplanned admissions or illness in hospital is absolutely not what they want.
I was sort of lost. I had nobody there I knew. Wasn't life. It was not a life at all.
Anything that we can do to sort of keep them more independent and healthy at home can make a huge impact. So the patient we're going to see today, Mrs. Minor, is someone that I think would really benefit from this sort of an approach. She has what we might, as GPs, consider frailty. And what we mean by frailty is someone who started to lose their independence, who has become weaker in herself, who's had a number of comorbid conditions that are unpredictable and can put her at risk of having admissions to hospital. And she's already had 2 unplanned admissions this year. I'd quite like to examine you in a moment, if that's all right, and then we'll talk about what we might be able to do with some of the members of our team to try and help, and in particular to try and reduce the chance of further admissions to hospital like that, and try our best to make sure that you're as well as you can be at home. It's about actually identifying the tier of patients who you can anticipate will have future needs. If you intervene successfully in these patients at an early stage, you then don't see the extra work that would otherwise have created for GPs, for ambulance crews, and illness, because you've avoided it, you've prevented it. Everything seems to be as good as it could be, considering you've just come out of hospital. The chest is nice and clear, that irregular heartbeat of yours is behaving itself. But there are a number of other issues, chiefly around trying to keep you out of hospital in future. We've got a local team called the Proactive Care Team. Now, that team has physios and occupational therapists, district nurses, a senior pharmacist who can review your medications, and then myself, who meets with them every 2 weeks to review where they've got to with some of their patients. And with your permission, I'd like to refer you to that team so that Elizabeth, one of our district nurses, can come and visit, and she'll do some further assessments and then draw up a care plan. Would that be all right?
Yep.
Fantastic, thank you so much. Mrs. Minor's a really good candidate for this approach, and she's quite accepting of the idea. I think she'll engage with it well. And the next step is we're going to discuss her at the MDT meeting and assign a key worker to visit and arrange some further assessments. She's quite frail. One of the issues is that she had an acute kidney injury on the most recent admission, and I think if we have a look at her medications, see that she's on 21 different items.
Shall we ask Duncan, our pharmacist, to review her medication?
I think that'd be really helpful. In particular, we want to ask Duncan to identify.
Prior to Proactive Care, we were having to refer in and out of services. We've broken down all those barriers. It didn't need to be there. We all need each other to work together, and we now allocate to people. We don't refer to people anymore. We are able to use all the services within our service and all the services within West Sussex County Council.
She's got some clear mobility issues from that and some equipment needs. Possibly a visit from you, Michael, the OT, would be quite helpful.
I think I'll just go around and have a general functional review and just see where she's at.
I've known Mrs. Minor now for 5 years, and I'd be more than happy to go out and do a full assessment on her. Right, Peggy, this is part of the assessment that I'm going to do today, because I'm going to do a contingency plan And what I'm going to do is I'm going to include your catheter and your leg ulcer.
Ambulance service, where is the help required?
The ambulance crew that are on scene with the patient will call in, and I'll talk them through the contingency plan that we have and the care record that we have for the patient on our IBIS system. When Proactive Care have popped on a contingency plan that actually includes baseline observations for a patient, that's really, really helpful for us. Often patients with chronic conditions won't have what we would consider to be normal baseline observations. Sats on air were 84%, so his baseline is actually quite low. If we know that that is indeed normal, or they're only mildly off their normal, then it allows us that more freedom to hopefully keep that patient in the community and treat that way. And perhaps we could refer him back to his case manager at Proactive Care for a review as well. Does that sound okay? No worries at all. Take care, bye. From the point of view of the ambulance service, if we are transporting patients to hospital, that takes time, it overloads the hospital system. It means that when the hospitals are busy and A&E departments are busy, we are also busy, and it tends to cause ambulances to queue at hospitals, which is a delay handing their patients over when the A&E departments are busy. So that then impacts on our services. So it has massive implications being able to keep patients at home and treat them there within the community.
We should have as much in the way of services closer to home that allow patients to be treated more and more at home and receive a range of interventions and better health outcomes as a result.
I've got good neighbours, loads of good friends. Very rarely is the house empty. I was so ill beforehand, I'd forgotten what my house looked like. Put it this way, I don't care what happens, but I am not going out of my home ever, unless it's because I've gone, I don't know about heaven, but I've gone completely.